At Trinity Healthcare in Rapids, we're very proud of the broad base of clinical experiences that we offer our residents during the training program.
One of the things that I really like about our program is that we're training residents who are destined for many different specialties, and it lets us really focus on what that core internship year should be about. And we want to make sure that our residents finish our year with us with a really strong clinical background and lots of experience taking care of patients who present with a diverse array of problems.
When I started my transitional year, or prior to signing up for all of our rotations, our program director, Dr. Sadowski, made a personal phone call to each one of us as residents to see what our expectations were for the year, which was really helpful because he was able to make suggestions for us on rotations that might be helpful and help us carry our blocks and our rotations towards what our future professional goals are.
As a resident here, they do a really good job of nurturing your interests and your strengths, whether you're someone that wants to get out and do a lot of procedures or someone that wants to see a lot of different pathologies. So I felt really supported in even making my schedule and getting to explore different specialties that I maybe didn't see much as a medical student.
I was coming into an intern year with a new son and a wife and a family, and I really wanted the sense that I would get the program support of having a family and having a life outside of work as well.
I had the opportunity to rotate through this hospital for a couple of my rotations as a third-year medical student, and I really felt a sense of family amongst not only the residents but with the attendings and other staff members as well. I could really tell that people like working together and that education is really valued here.
We allow our residents independence to be challenged by their clinical cases, but also in a supportive environment where you have good backup by residents and attendings that are ready to help support you and educate you as well.
We spend some time building a didactic program that helps our interns to learn, to grow, both professionally and also in their clinical knowledge, to be prepared for exams, sure, but also to be prepared for taking care of patients in the clinical context that they're going to find themselves in down the road.
When you're rotating through different departments, they really integrate you well into the team and into the department. You're not made to feel like a rotator and that you're just observing. They really get you in, especially on the floors and in the emergency department. You get to do all the procedures. You're a primary call person on all your patients, so you really get to take responsibility.
The program leadership is really friendly and really supportive. Our program director, Dr. Sadowski, he's really supportive in everything. I feel comfortable talking to him about my personal life, anything that's going on in rotation or outside of rotation. And I think that sets apart the good programs from the great programs.
As a medical student, I heard that the onboarding process of getting all your licensing done and everything to become a resident can be a lot of work, it can be stressful, and having gone through that now for the first time, it was really helpful having a program coordinator, Kate, who was really organized, who was really helpful throughout that entire process. So it made becoming a resident and going through all the licensing a lot more smooth than I had anticipated.
I feel really comfortable with all of my co-residents and also with all the program faculty. The program leadership is very accessible. They not only care about us as residents, but as learners and individuals.
We think mentorship is very important. We're here to help you become the best doctor that you can be, and some of that's going to be the material that you learn, and some of that's going to be the way that you grow as a person when you're with us. So developing relationships between the faculty members and the residents is really important to us. We want to be able to support you as you move forward in your career.
The last thing I really wanted to talk about was the sense of family you have with the other transitional year residents. Even though intern year is going to be really busy and there's a lot of medical knowledge to be learned, there is time to go outside of work and really enjoy the city, and our program really gives us the resources for that. That's one of the nice things about being a transitional year here is that there is a social fund and we can take advantage of that.
Although we're not technically a department, they really make the program feel like a family. We feel like a cohesive unit. We do activities together. We even have our own fun to do activities outside of the hospital, go to dinner, go to movies. We have a retreat annually where we all get together. The hospital has done a really good job overall promoting culture, and that we're all a team. We all support each other regardless of what your role is. We have a connected mission, and I feel like that really translates down into the residency programs.
The residents here are happy, they enjoy what they do, they enjoy who they work with, so it's nice being a part of the team here.
The culture's different, the people are different. You never have to wonder where people are coming from or why they're doing something or suggesting something. It's all for the right reasons.
We want you to complete your training and realize what a wonderful place this is to work. Come back and spend the rest of your career at Trinity Health Grand Rapids. We're very proud of that.